Senior Analyst with the Healthcare Policy Initiatives team on the eligible hospital side, and along with me today is Stephanie Souza, a Senior Analyst on the Healthcare Policy Initiatives team on the provider side. And we have additional representation today from MEDITECH Interoperability Group to assist with facilitating this discussion. A few things to note before we get started. Today is an interactive session. So at this time, everyone is muted. At several points during our presentation, there will be an opportunity for questions. For questions, we encourage those who join by computer speakers to use the raise hand feature, and we will unmute your line so that you can ask your question live. If you join by phone, you will need to enter your questions into the Q&A feature. You can enter questions into the Q&A at any time, and they will be answered where appropriate as we move through the discussion. Please know that this session is being recorded so we can continue to track questions about this topic. In addition, a follow-up email will be sent in the coming days, which will include a link to resources and answers to any outstanding questions from today's session. So, as most people have joined now, let's get started. There have been a lot of questions and discussions specifically about the overall process for enabling the API so that a patient can retrieve their health information via an application of their choice. On today's agenda, we will start with reviewing the measures requiring API functionality and include an overview of what the process looks like when a patient wants to retrieve their health information via an application, the process from the patient's perspective, and then discuss the two required components for this measure. Then we will begin our roundtable discussion on the following topics: offering access and enabling API functionality. We will highlight important information and include frequently asked questions, giving you an opportunity to ask additional questions. We will wrap up with the topic of onboarding applications and, time permitting, allow for any final questions. For the Promoting Interoperability Program for eligible hospitals and critical access hospitals, and for the QPP MIPS program for eligible clinicians, the Provide Patients Electronic Access to Their Health Information measure requires that the patient is provided access to view, download, and transmit their health information via a portal, and that the health information is made available for the patient to access via an API using an application of their choice. The Medicaid-only threshold-based PI program measures Provide Patient Access and View, Download, and Transmit include the same requirements. For today's discussion, we will be focusing on the API, and we will not be covering portal enrollment. Before we get into the required components of these measures, let's first walk through what the process would look like when a patient wants to retrieve their health information via the API using an app. First, a patient identifies an app that they would like to use to access their health information. They follow the instructions provided by your organization to request use of the app. If the application is vetted and onboarded, your organization will notify the patient that access is now available. Once notified, the patient accesses the application of their choosing on their device and are asked to authenticate by entering their credentials. Depending on your setup, the existing MEDITECH portal username and password could be used to authenticate, or they could log on using their username or password for a third-party identity provider such as Google. Once authenticated, they request their health information. Depending on the app, this could include medications, lab results, or more. The API retrieves the requested data from the MEDITECH EHR and returns it to the patient to view within the app. This is the overall process. So now let's talk about how you get all of this to happen and meet the measure requirements. There are two components to meet the API requirement. First, you must offer to provide the patient access to their health information, and second, the API functionality must be fully enabled such that any application chosen by a patient would allow them to gain access to their individual health information. A patient must be offered access to their health information via a portal and via an API. Your current process for offering patients access to the portal can be modified to include information on what to do if a patient has an app that they would like to use to access their health information. The primary methods you should use to record that access to the portal and API were offered are documenting a query or printing a discharge or departure form. In addition, MEDITECH SQL report also identified patients who both enroll in the portal and authenticate in an app of their choice via an API. However, it is anticipated that few patients will be completing both of these actions during the measurement period, so our suggestion is to ensure a query is documented or a discharge or departure form is printed and provided for each patient at every visit, as these methods will primarily drive your numerator values. So at this point, I am going to stop to ask the first couple questions. Has anybody on the line right now already rewritten their query or had any discussions about how they want to reword their query? And also, if anyone has some sample text for the discharge form that they would like to share for your solution, we'd love to see that as well. On the next screen, you'll see that MEDITECH has provided an example text as well. This is something that you could put on your discharge forms or on any information that you'd be handing to a patient, as well as on your website if you wanted to. The one that we offer allows you to contact the website or the help desk. That's the process that we envision using. You can use any process you want to onboard the applications and reflect that in your text. So does anybody within the Q&A feature or the hand raising feature want to share what they are using or have any questions about what we're recommending on the screen right now? Okay, well, it seems right now we don't really have any questions on this particular topic, so I'm going to hand it over to Stephanie to start discussing enabling APIs. Do keep in mind, if you want to follow up on this later, you can enter a question in the Q&A or raise your hand later on in the presentation.
Okay, so as previously noted, the API functionality must be fully enabled so that any application chosen by a patient would allow them to gain access to their individual health information, provided the application is configured to meet the technical specifications of the API. There are 4 steps for enabling your API functionality for use with an app. The first is we implement the RESTful infrastructure, complete the content build for the PI3 CCD, accept a mass delivery of code for patient access, and set up your preferred authentication method. During the process of enabling the API, the full Stage 3 CCD build must be completed for use with the API because applications may request the full range of CCD data elements for patients to view. For the additional patient access code, NMI tasks have been open to deliver it. This code can be moved live following basic functionality testing as outlined in the initial task entry. MEDITECH Portal and MPM customers may have related tasks for additional code, which must also be delivered. Once infrastructure and code are in place, MEDITECH will open a staging task to assist with the setup of your authentication realm. There are 2 methods for the authentication. The first is using the MEDITECH Portal credentials, and the second is using a third-party identity provider, or IDP. We are posting a poll for you to indicate which of these 4 stages you are in. Please select more than one if you are working on multiple steps together, and we'll give you a couple of minutes to respond to the poll.
Stages of API implementation. Currently, I can only select.
See, that differs by site as to where I'm at.
Yeah.
It's cutting off down here.
So in the meantime, in the last few seconds while we wait for the poll to finish being filled out, we did get a little bit of feedback in the Q&A about some more discharge instruction data that's being provided. Anadeo from Kershaw Health sent a kind of comprehensive instructions on how to use a MyLinks application that they are working with. And the text that they're using essentially says that MyLinks is a new free application that they've partnered with to share your data, and they give you a couple steps on how to access it. And then once you go through those steps, you're brought to the portal where you can then use your portal login credentials to import or transfer your data to the MyLinks account. So what they're going with is not just some short text about how to sign up, but they're also providing a comprehensive step-by-step list as to how to get the enrollment started, which is another great way to go. It looks like we have most of the poll responses in now. It looks like the bulk of the folks on this call that have answered the poll are working on the CCD content or are primarily focused on the CCD content. And then it is a fairly close split between the other three steps. So I would say it looks like the majority of the folks that have answered are heading towards the second half or the last little bit of this setup. But we do have a few people still in the infrastructure phase. So does anybody on the line right now that answered these questions, does anyone that's in the authentication realm phase have any questions they would, or any advice they would like to give for someone who's about to enter it, anything that they encountered that hung them up? Anybody that's taking additional code deliveries have any advice about how to make that process more streamlined for you? Or did anybody that's currently working on the CCD content have anything that they would like to share with those in the infrastructure phase about getting that set up and moving more quickly? We can give you folks a couple seconds to respond if you would like, and we'll just close this poll out.
I would love to respond, but MEDITECH would get upset with me. I'd tell them that, yeah, I can't get anything done because you guys aren't getting your stuff done.
Yeah.
I'm held up because of you. So, I better not be that critical. I'll do that in private.
So we have a question from Julia. We use a third-party portal and currently send our CCDA outbound from the interface manager. Will this still be available, or will this whole functionality change with the API going live?
So Julia, this will not change too much. You will be able to use the third-party portal, but not, you can continue to use the third-party portal. You can't use that portal to have patients authenticate via an API, but that will not affect your CCD in any way, shape, or form. If you haven't already, you do have to do the new related build for Promoting Interoperability 3, as that's the data that will be in that CCD and that will be available for a patient to get at via an API if they so choose. So those are the major changes involved. It's just the build related to it. Otherwise, your use of a third-party portal and sending CCD outbound will not change.
Great. All right. So we're going to keep moving forward. There we go.
Okay, so after completing the 4 steps on the previous slide to enable the API and offering your patients access to their health information via the portal and an app of their choice, you have met the requirements for patient electronic access. Please note that CMS specifications do not require testing with an app prior to your reporting period. The steps we just reviewed will enable the API functionality for use with any app that you would like to onboard into your system in the future. It is also important to remember that you do not receive a penalty for low buy-in with API usage among your patient population. What is important is that you have the ability to meet the functional standards for onboarding an application. CMS views the use of APIs as a growing part of the healthcare experience, and as with all technologies in their infancy, it's normal for utilization to be minimal at the start. Having the necessary infrastructure in place leaves you in compliance with the measure and in a position to be better prepared once there is a greater demand within the industry. So now that we have covered the steps to enable access, we want to shift the focus to the authentication portion, as this is the step many of our participants are entering at this time.
Nice to hear that.
We will cover a couple of the most frequently asked questions before opening up for your comments and questions. So the first frequently asked question we receive is which third-party IDPs can be used? MEDITECH has tested this functionality with Google Identity Solutions. However, any IDP that utilizes OpenID Connect or SAML 2.0 can be utilized. Before selecting an IDP for your organization, please work with MEDITECH so due diligence can be done to confirm its compatibility with RESTful API infrastructure.
I'm gonna have to put overlays on top of this.
Another frequently asked question we receive is the manage user identities routine outlined in the provider-to-patient exchange best practice required when authenticating via MEDITECH portal credentials? The answer is no. As noted in the best practice, for organizations with a non-MEDITECH portal, the patient must be added to the manage user identities for patient access routine in order to provide the patient with credentials to sign into the API application. When organizations use the MEDITECH portal, the patient will use the same credentials for the API application that they use to access the portal. So does anyone have any questions at this time? If so, please raise your hand or use the Q&A feature.
And we'll just take a moment to wait for any questions to come in. Looks like we have a question from Moshkan. Hi, you're unmuted. Hi, Moshkan, are you there? Okay, well, you can enter your question in the Q&A.
Okay, so we do have a question from Moshkin in this Q&A. The question is, the best practice suggests Google as an IDP. The API app My Patient Link hasn't talked about authentication with its own My Patient Link login. Should we inquire about this?
So Moshkin, some of our customers have used My Patient Links in testing it out. They've also tested out in our developer sandbox Greenfield, and they have used Google to authenticate it in all of those situations, other than using MEDITECH patient portal in some of those situations. So in terms of getting to the end of this and getting it stood up, your best bet would be going with Google. They would know the best way to get through it if you're not a MEDITECH portal customer. If you're a MEDITECH portal customer, using the portal authentication would be your best bet.
We have another question here from Julie. I know this presentation is patient access focused, but what about other physicians, practices, health systems that would like to access the same information? Is this API a viable solution for that functionality?
So not necessarily. So the authentication means to do that is different. So for example, you're talking about, if we were talking about physicians looking for access to that data and they had some type of mobile rounding app that they were using, there would be a cross-reference to what access that provider had to what patients, which is a different type of authentication. So we're working towards that. Specific to patient access, you couldn't necessarily use, you can't use what we have in place to do it with, whether it's other health systems, physicians, practices, things like that. But that's something we're working on our roadmap down the road.
So we're going to keep moving forward. If you still have questions, keep entering them in the Q&A. Again, we're going to have time for questions at the end, so we can get back to anything that's off topic a little bit later. So let's talk a moment about onboarding applications via the API. This measure does not require that the eligible participant provide an application for their patient's use. Patients must have the ability to access their information via an application of their choice as long as it meets the specifications of the EHR. So what happens when a patient provides an app that they want to use to access their health information? When an app is presented to your organization, it is up to your organization to develop security policies and procedures for screening and vetting apps that have been released by or that have been presented by patients requesting their health information to ensure it is safe and compatible. Next, open an NMI task so that MEDITECH and your IT team can configure the application. You are then able to notify the patient that they can access their information with the application. There are additional considerations on this topic, which can be found on our RESTful resource page in the fact titled, "Does my organization need to provide patients with a specific app to use for accessing their data via the API?" This frequently asked question includes a link to more information on the hhs.gov website. So at this time, has anyone that's gotten a little bit further along begun to discuss how they intend to handle application onboarding? Does anyone have a plan for notifying the patient after you have onboarded an application that it has been vetted and they can use it? Please feel free to raise your hand or enter the Q&A, enter your response. You can also ask any question related to onboarding applications at this time as well.
From the time the patient asks or presents an application to the time they get into it, I think people are still using their smartphones.
So another question from Julie. We have our current MU2 version of the CCDA. We only have a single document or note attached to the CCDA outbound. This is a particular complaint of our patients. With the new API version, will the patient be able to access all or more of the documents and notes from their visit?
So with the MU3 version of the CCD, we have the ability, in addition to the structured CCD document itself, you can send the referral note and the discharge summary as well. That's just setup based when you're implementing the stage 3 measure.
All right, well, really at this time, the presentation itself is more or less over. We're just here to answer any more of your questions that you have. So if you have questions on anything we covered or did not cover related to patient access, please feel free to ask your questions now, and we have plenty of time to address them. So we have a question from Sandy. How would we know how to vet an app? Will MT provide a sample procedure on how this would be done? Right now, it is up to organizations how you vet an app. There aren't necessarily CMS guidelines out there telling you step-by-step ways to authenticate, but there are standards that need to be met to be a FHIR application. One rule would be making sure that they are a FHIR application, but your organization does have to develop an internal process that meets your own security and network concerns in order to decide whether an app is viable for use with your organization or not.
All right, we have another question from Kevin asking, does MEDITECH have any applications we can test our API connection with?
So Kevin, if you're looking to test the viability of the output or being able to authenticate without committing to an actual application that might be out there, we can work with you to use an open source tool called Postman, that if we work with you to set up a few example patients in your test system, use that tool to call the API resources and output the data that we would expect it to output, in addition to being able to prove the authentic or be able to authenticate with that patient credentials. That would satisfy all the, checking all the boxes with being able to say this API or these APIs are functional. That's what most of our customers have been doing. They have not necessarily been testing directly with an app vendor. So that's the route we would suggest maybe taking. If there's something more specific or you have an app in mind or one you'd like to speak about, you can reach out to the NMI group and we can kind of guide you as where to go with that, any particular vendor.
Okay, we have a message from Anne regarding that her facility uses the MEDITECH portal, so that's what they're using as their identity provider. And they did start with MyLinks app in their test environment. The experience they had is that the data did flow to MyLinks. They've moved the app to working in live, and they feel that they are very close to getting that to work 100% in their live environment. And Anne does recommend that MyLinks is a great app to work with and that they were very responsive. So thank you, Anne.
Question from Sandra. Do you have a timeline for Apple Health to be available?
So, folks who are at Muse were aware of Hoda's statements regarding Apple and its availability for MEDITECH customers. So at this point, we're in the final stages of certifying our 6X and Expanse platforms with them. We expect that will be done before the end of July, and then we'll be moving on to CS and Magic. So I can't really put a date on the CS and Magic certification because a lot of it's dictated by Apple's timelines, but if you're an Expanse or a 6X customer, it will be available relatively.
That's interesting. There's some additional certification process they have to go through with Apple.
Okay, so our Q&A line is cleared out now. Does anybody have any questions regarding anything about this measure? We are happy to take it right now. This is an interactive session, so we are here to answer your questions. So is there anything regarding the interpretation of the measure? Is the performance-based threshold calculation understandable for everybody? Any questions about reporting it? Anything at all? We're happy to take them all right now. Okay, everyone, it doesn't seem like we have any more questions. If you think of anything later, you can contact me and ask a follow-up if you'd like. The follow-up from this session and all additional sessions will be coming after we wrap up the roundtables. So each individual session is not getting a printed follow-up email with a Q&A, but we will provide a compiled list of what we have, of the takeaways basically from our roundtable sessions after we do wrap them up. So do keep an eye out for that in probably the next week or two. We will be sure to get that out to all attendees. Looks like I can give many of you a good portion of your afternoon back, so have a wonderful day. And thanks everybody for attending.